Hey guys, Dr. Norris Goldberg here, owner of Koru Chiropractic and clinical director. And today I want to talk to you a little bit about thoracic outlet syndrome, right? Or TOS. And we have a lot of patients who have come in, some buzzing in their hands, some numbness and tingling, and have been told several different diagnoses potentially. Sometimes it's labeled as carpal tunnel syndrome. Sometimes they're just said you've got an impingement of a nerve or a blood vessel, and sometimes they get a thoracic outlet syndrome diagnosis. But in many cases, these patients are coming in with problems that are responding sometimes in one hand, but typically in most cases with TOS, you're gonna get it in both hands, right? And it's also gonna feel like it's all the hand versus say just 3 of these fingers or these 2 fingers, right? That's usually typically more of a nerve entrapment somewhere. It's not necessarily vascular versus when it's vascular, if we compress and impinge on these blood vessels that come off of our aorta and go down into the arms here, that's gonna cause tingling, right? Just like when your leg falls asleep on the couch or your arm falls asleep on the couch or in bed, you get that dead arm feeling, right? That's essentially a lot of the symptomatology of thoracic outlet syndrome, except it's happening all the time. It's like you're just standing there and all of a sudden your arms are going numb. So how do we correct this problem chiropractically? Well, I find that there's 2 main components. There's a functional component and a structural component. Okay, so let's talk about that structural component first. The structural component is typically what we call forward head posture, or also known as anterior head translation. It's when your head doesn't sit quite over your shoulders the way we want it to see or be. What we see is that the head starts getting into this position, right? And as the spine moves forward into that position, it really compresses the area of the cervical thoracic junction here, where these blood vessels are essentially coming out of the top of the rib cage and then going down through almost like kind of your armpit area, right? But right through this area here is a very tight space, right? And there's not a lot of room for the blood vessels in the first place, let alone if you have forward head posture, okay? So when you have the structural issue, you usually also have some really tight muscles that are accompanied with it as well, right? So these tight muscles that are connected to your clavicle and your first and second and maybe even your third rib, like things like the scalenes. If your scalenes will get really tight, and when they're really tight, they'll actually start compressing down on that space as well, right? And so that would be referred to as upper cross syndrome, right? And I've made videos and talked about both forward posture and upper cross syndrome and how we correct those issues in the office. But for today's video, it's very specifically about the diagnosis of thoracic outlet syndrome right now. So the other issue is that we have to rule out is structurally is making sure that you don't have like an extra, like what we call a cervical rib, right? Or a elongated transverse process. These are actually structural things that I will not be able to overcome with chiropractic corrective care, okay? So when we find someone with this problem, when we take an x-ray and we can see those issues, I would be referring them out. Now, most cases, someone who has that type of TOS has already kind of gone through the medical progression. They've seen a neurologist take an x-ray, they send them to orthopedic and they get that thing cut out, okay? Now, a lot of people though, when it's not that severe or when they don't see a structural issue like a cervical rib, then they say, well, you know, you just got to deal with it. It's just something vascular is going on, right? There's not a lot of help for these types of conditions, right? And so the next thing, if it's not structural, right? So we've ruled out you don't have something that we can't fix, and if you have forward head posture that we can fix that. Well, another problem and downstream effect from the forward head posture, but even just simple misalignments in certain areas of your spine. When you have a misalignment at this top area of the spine, what it does, it starts to alter the function of the nervous system, right? And so the nervous system, in particular in this area of your spine, those are your sympathetic chain nerves, right? So those nerves are actually coming off T1, 2, and 3, and they go to the heart, they go to the aorta, they also send little branches up into the cervical spine and up actually even into the head, and they control certain parts of our autonomic system, including how we open and close our blood vessels, so vasodilation and vasoconstriction, okay? And so if this area of the spine is being impinged, it can cause abnormal blood flow patterns in certain parts of the body, and this is an issue that we see when we adjust that part of the spine get much better, right? People will tell me how, wow, numbness and tingling sometimes gone almost immediately. Other times it can take a little while, especially if there's a lot of postural correction that we have to do, you know, or postural restoration, right? That doesn't just happen overnight. Sometimes we do an adjustment and then people stand up a lot straighter right away, but we really need to strengthen and stabilize that spine. And that's really what we specialize here at Koru Chiropractic, is we take an advanced approach when it comes to chiropractic care. We're not just cracking your spine. We're doing very specific adjustments restoring the function of your nervous system and improving the alignment and posture of your spine so that you can function at your best ability, right? Because actually that's what we want. We want you to feel better, but we really ultimately want you to function better, because we know when you're functioning better, you're gonna get the most out of life and get back to doing those things that you're probably feeling limited in at this point, especially with thoracic outlet syndrome. You know, you're dropping things, your numbness and tingling, you're gonna start avoiding activities, right? Because it's causing pain or it's causing discomfort. And so if that's a problem that you're suffering with, we would really love to help you out. I have a great success rate with people who with T.O.S. type symptoms, vascular numbness and tingling into the hands. And if that's a problem, give us a call, and we'd love to do a free consultation, and then we can do our neurostructural testing to see exactly where the problems are and how it's related to your conditions. Talk soon.